I want to give thanks to the organizers for inviting me to this activity to give you the local experience on how we treat urologic cancers using radiation treatment. Urologic cancer is really the domain and expertise of the urologists here in the country. We, the radiation oncologists, are their allies, and we have to work in line with the overall plan of management for the attending urologist. In most situations, the radiation treatment is just part of the treatment. Radiation treatment in the Philippines poses some challenges and difficulties compared with the rest of the world. Oftentimes, international treatment guidelines will not exactly apply to our local setting. These challenges are pointed out in this publication done in 2015 by some radiation oncologists working at the UP Philippine General Hospital, which I will be pointing out in my next slide. To start with, I will be using this cancer database. This is the Philippine Cancer Facts and Estimate Report for 2015, published by the Philippine Cancer Society Manila Cancer Registry. This data source is our main information for our cancer management. Data is primarily taken from hospitals at the National Capital Region and extrapolated to represent the data for the whole country. Also, because of financial constraints, the actual data collection is not done yearly, but every 5 to 10 years. So, data reported may be of 10 years ago. This table from the Philippine Cancer Facts and Estimate shows the common cancers in the Philippines. The top 10 cancers are in green background. Breast is the most common, followed by lung, colorectal, liver, and cervix. Prostate is only ranked 6. This ranking of prostate cancer in our country is low compared to the Western countries. This graph from the Philippine Cancer Facts and Estimate shows us both the incidence and mortality of the 10 leading cancer. If we look at prostate cancer, mortality rate is high in relation to the incidence. Uh, it's more than 50%. This is very surprising. Our computed mortality rate is 53%, very high compared this with the US and Europe, as shown in this table, which is only 10 and 14% respectively. Now, in terms of radiation service in the country, the first recorded radiation treatment was in 1910. But regular radiation treatment was started in the 60s using cobalt machine units. We have a total of 6 units at that time. The first modern machine, the linear accelerator, was placed in the lung center of the Philippines in 1983. The Radiation Oncology Society was established in 1998, 1988, sorry. The first local training program for radiation oncology was established in 1992 at the Philippine General Hospital. And since then, we now have 8 training institutions, which all of which are located in Metro Manila. And as of 2015, we have a total of 22 facilities and 65 radiation oncologists for the whole country. Regarding radiation modalities that are available in the Philippines, we have 3D conformal radiation treatment in all facilities. IMRT and IGRT is available in only selected facility. The low dose rate brachytherapy, the seed implant, also in a few selected facility. The high dose rate brachytherapy we have we are is available, but we have limited experience. And the specialized stereotactic body radiation, which is now being used for prostate, is also very limited in terms of facility and experience. We do not have proton beam facility in the country. Now, regarding health insurance coverage for radiation treatment, PhilHealth, the national insurance, covers uh, radiation treatments. It fully covers the 3D radiation treatments and partially support the IMRT and specialized radiation treatments. Sad to say, private insurances has limited support for radiation treatment. To give you my local experience in the practice of radiation treatment, I will be using radiation treatment data at the Cardinal Santos Medical Center, a tertiary private hospital located at the center of Manila, Green Hills area. For for the year 2019, this is the pre-COVID year, we treated a total of 520 cancer cases at our facility. Only 21 cases are urinary or 4%. And of the 21 cases, we have 80% of those is for palliative treatment, mostly bone mets. And only 10 out of the 20, only 2 of the 21 or 10% is for curative treatment. Also worth mentioning is that Cardinal Santos Medical Center is one of the few hospitals that does prostate brachytherapy seed implant. And for that year, 2019, we did 13 cases. I do not have the data of surgical treatments for prostate. In summary, regarding cancer treatment in the Philippines, majority of our cancers are advanced and metastatic. Consequently, majority of our treatment is for palliation. And in the few curative treatments, majority undergo radical surgery versus the organ or conservative regimen. Major limitation for the early diagnosis is finances, and few hospice care facilities are available, and the family cares for the terminally ill. Thank you.